what is the message when you look there at those deaths, or indeed earlier ones, about how we really should be reacting to this coronavirus?
Well, Andrew, every single death is a tragedy, and it underscores that this virus can be very deadly and very contagious in certain circumstances. What these three deaths tell us, Andrew, is that it's likely to be those that are elderly, vulnerable, those with pre-existing health conditions that are most exposed to the negative effects of this virus. And indeed, that is where the efforts of government intervention should be focused. I would say absolutely impose very stringent conditions around known hotspots where vulnerable people are exposed to the virus. But instead, what has happened, Andrew, is we've had blanket bans on economic and social activity and restrictions imposed by Commonwealth and state governments, often without regard to the risk that those activities pose to vulnerable population and to the spread of the virus. Reading a book on a park bench, fishing, playing golf, a variety of social and economic activity that can be very safely undertaken with appropriate social distancing. So what this tells me, Andrew, is the efforts of government should be focused on those that are the highest risk, whereas other areas of society and the economy where some of the isolation measures can be relaxed, that is what they should be doing.
Right now, just 4 new infections in 24 hours across the whole country, Rita. Scott Morrison, the Prime Minister, said yesterday the bans nevertheless had to stay for a month. Is that reasonable in the circumstances?
Well, they don't seem to be reassessing their goals based on the data that's coming in. Why stick to these stringent weeks of lockdowns when the data's telling them something entirely different? I would have thought they'd be far more reactive. And we are seeing in the US states opening up. Texas, for example, end of the month, they're looking at opening up. They've got 500,000 jobs, the governor says, that are ready to be filled. They want to recharge their economy, and they're doing it in a sensible way. It's not going to be just let it rip. They're going to do it in a staged manner, but they want to get their industries and their people working again. And the cost of this shutdown cannot be underestimated. Of course, any death is tragic, whether it's someone who's 92 or someone who's in their 70s. But we know from the Italian studies that the majority of those who died had 3 or more comorbidities. So we know people who are vulnerable, people who are elderly, need to be protected for perhaps many more months to come until there's an effective treatment or vaccine. But locking down healthy people who need to work, who are growing more and more despondent, I just think that is there's got to just be greater thought and debate. It seems like you can't talk about it without people accusing you of wanting to kill old people.
Yes, I know, it's just so crazy. I mean, at 60, I'm verging on the vulnerable anyway. I mean, for heaven's sake, I'm not arguing for my own cause here. Daniel, at least, look, Rita said the government should be reacting more closely to our data instead of trying to pick a worst case overseas, like, look at Italy or look at New York, or now it's look at the second wave in Singapore. They should look at our data. Now, at least it has, the Prime Minister said, well, start off by saying 6 months, now 1 month. But, 1 month, I don't know whether we can wait 1 month. What is the government actually waiting for?
Well, it's a good question, Andrew, and it gets to, I think, a couple of important issues in this debate. One has been the idea of flattening the curve was never necessarily about reducing the aggregate number of people who may contract the virus, but ensuring that our health system can keep up to a point where those who do contract the virus will receive the appropriate health care. Now, when you look at the availability of ICU units or ventilators, in addition to the statistic you just showed there, Andrew, that graph showing that the curve has indeed flattened, well, that would suggest that the social isolation measures, insofar as they have played a very important role, and now it's time to look whether we can start opening up the economy. And I think doing it in a triaged approach is sensible. And one thing, Andrew, that I think a lot of Australians have wondered is the health advice we've received is 1.5 metre isolation. So you should stay 1.5 metres away from other people and practice sensible personal hygiene. Now, there are a lot of activities that are banned at the moment, Andrew, where you could quite safely use that health advice: restaurants, cafes, some retail, family gatherings. You could undertake these activities in a safe way, and that would make sense as a first triage, as a way out of this, because the rules have been excessive, and it's now time to start to lift them, Andrew.
Oh, high time. Hey, Rita, something that really, I had trouble with this. I mean, Annalise Nielsen earlier in the show gave an explanation about, this is the best we've got, so try to make the best of it. Australia's going to push for the World Health Organization to be given the powers of an international weapons inspector to enter a country like China without invitation, which would be good when it comes to China, to trace the source of outbreaks in any future pandemics. But I keep coming back to it. Can we trust the World Health Organization to actually do that?
Well, I would think before you give them new sweeping powers, you would want a little bit more accountability and competence displayed.
New leadership
and also,
start.
And new leadership that doesn't kowtow to China, and new leadership that listens to the Taiwanese authorities when they warned them back in December about the risk of human-to-human transmission, when they were still parroting China's lines in mid-January saying there was no human-to-human transmission, when they were parroting China's lines about travel bans being completely ineffectual and just adding to bigotry and the stigma of the disease. So they have been compromised throughout this process. They've been inept, and to just reward that with new powers, to me, seems counterintuitive. Surely you want to have some meaningful change, and then you can empower them to go in and inspect as they wish.
Yes, I think that's right. First ask them, why should I trust you? And by the way, get a new leadership. Then we'll talk about the rest. But right now, besides, China wouldn't let them in anyway.